Hey everyone, I'm Lindsay, and I'll be your guide inside and out of the cell as we explore bacterial cell structures. Today, we will be talking about some common and unique features of these pesky bugs that allows them to evade our immune system, be resistant to antibiotics, and how we can circumvent their toxic traits and treat and obliterate the infection. Without further ado, let's start on our structure symposium. Today, we have two pretty broad learning objectives that will cover the entirety of our bacteria basics. We will walk through the whole gambit of bacterial structures by describing their composition, factors contributing to virulence, resistance, and antibiotic considerations in light of these characteristics. And lastly, we'll compare and contrast gram-positive and gram-negative organisms. Let's get a move on and start from the outside and work our way in. Let's start from the outside in with the bacterial capsule, a common structure to many gram-positive and gram-negative bugs. This outer envelope layer is composed of polysaccharides in most bacteria. But do you know an exception to that rule? Bacillus anthracis' capsule is made from repeating poly-D protein molecules. This is a common distinguishing feature of the Bacillus anthracis species, so take note for test day. Because capsules are so tightly organized, they are resistant to most stains. This means they will appear like a halo around the organism that they protect, much like the image we see to the upper right. So why do we care about the capsule? This layer is considered a potent virulence factor because it promotes resistance to phagocytosis by macrophages and therefore evasion of our immune system. We circumvent this by vaccinating individuals to common capsular polysaccharides that allows antibody-mediated phagocytosis and elimination. However, if you remember your immunology lectures, polysaccharides are not very immunogenic. So, we conjugate them to proteins, which creates a much more responsive immune and memory impression to these bugs. An important side note about encapsulated organisms that you should remember both for your test and clinicals are asplenic patients. The spleen is where encapsulated organisms are opsonized with antibodies and phagocytosed for immune responses. Patients with functional asplenia, like some with sickle cell, or those who have it surgically absent, are at increased risk to infection with these virulent encapsulated organisms. Can you remember the 3 organisms asplenic patients must be vaccinated against? These are Haemophilus influenzae, Streptococcus pneumoniae, Neisseria meningitidis. This is a high-yield connection come test day, so remember these 3 bugs and their vaccinations. Moving inward, we have the slime layer. In contrast to our capsule, the slime layer is composed of loosely packed polysaccharides that promotes adherence to surfaces like prosthetics and catheters and is another protective layer against antibiotics. The slime layer that many bacteria create makes eradication difficult to achieve depending on how thick and how many layers are present, which makes removal of the catheter or implant an important consideration. Next, we have our bacterial outer membrane, which is the location of the most notorious and nefarious of the virulence factors for gram-negative bacteria. The outer membrane is composed of lipids, proteins, and channels like porins that all convey unique virulence factors. Porins are abundant protein channels that allow for both influx and efflux of electrolytes, nutrients, and antibiotics. Bacteria with upregulated efflux porins and pumps convey significant antibiotic resistance. And like many proteins, the outer membrane proteins of gram-negatives are highly antigenic, which will send our immune system into overdrive. Moving on, let's discuss the heavy hitters of the outer membrane, the endotoxins, like LPS, LOS, and lipid A. These lipopoly or lipooligosaccharides are highly immunogenic and star as common culprits for the stress response of infection. Notably, lipid A is the lipid anchor of LPS to the bacterial membrane. And once released into systemic circulation with lysis of the bacterium, induces massive releases of TNF and IL-1, which can promote fevers, diarrhea, and possibly induce septic shock. All right, 3 envelope structures down and 3 to go. Let's move on to the next slide. Next, we have the periplasm of the cell, a component only found in gram-negative bacteria like our outer membrane. The periplasm is a concentrated, thick gelatinous matrix that houses many enzymes and materials on their way out of the bacteria. Most notably, the beta-lactamase enzyme is housed in the periplasm, which is an exceedingly important consideration for antibiotic resistance and choice of agent when combating infection. We then have our cell wall, which is a sturdy sugar peptidoglycan stability structure. Try saying that 5 times fast. This structure is also dependent on lipoteichoic acid components, which can convey some degree of pathogenesis and immune reactivity by activating the alternative complement pathway. The cell wall is the main differentiator when it comes to gram-positive and gram-negative bacteria that we will discuss on our next slide. The cell wall is also the target of one of the most famous antibiotics. Do you remember which antibiotic targets peptidoglycan? Penicillin. Remember that penicillin prevents the cross-linking of peptidoglycan that will cause the cell wall to break down and subsequent bacterial death. And our last envelope structure for today is the cytoplasmic membrane. This is the last line of defense and barrier between the inner bacteria and outside world. It is composed of phospholipids like any other cell membrane, in addition to penicillin binding proteins, which is where the antibiotic exerts its effect to inhibit cell wall synthesis. The cell membrane houses many important enzymes for oxidation, transport, and cell wall synthesis. In gram-positive organisms, the cell wall has lipoteichoic acids that extend past the surface of the organism and induce an inflammatory response by instigating TNF-alpha and IL-1 release. Phew, good job. We covered 6 important bacterial cell structures. Let's move on to gram-positives and gram-negatives. All right, let's talk about one of the foundational classifications that will be key to differentiating bugs on test day and in clinical practice: gram-positive and gram-negative. A few structural differences make all the difference in these two classes of organisms. Remember from our previous slides that only gram-negative organisms have an outer membrane in addition to their cell membrane, where gram-positive lack this structure. Additionally, we have a huge difference in the thickness of peptidoglycan layers. When it comes to gram-negatives, this layer is thin, maybe only 2 to 3 nanometers, which is a stark contrast to the gram-positive, which have a thick layer up to 20 to 80 nanometers, which helps retain that characteristic purple stain. Now that we've gotten through all the surface level talk, let's move on to cellular projections and specialized proteins. The 2 main cellular projection proteins that you'll need to know come test day are the flagellum and the pilus, also known as fimbriae. First, let's talk flagella. Flagella are one of the most characteristic extracellular whip-like structures projecting from the cell wall, as you can see to the upper right, that are used for motility. Can you name a few bacteria with this recognizable structure? The infamous ulcer-inducing H. pylori, E. coli, food-poisoning Salmonella, and the diabolic diarrhea bug Vibrio and Campylobacter all contain flagella and have motility as one of their distinguishing characteristics. Our next notable extracellular projection are the pili. These glycoprotein projections are small and hair-like and are quite fragile with constant turnover. And in contrast to their large flagella counterparts, are not used for motility, but for adherence and attachment. Pili are quite antigenic, and because of their constant turnover, can have different compositions that result in resistance and increased virulence. Notable bug with pili and fimbriae that promote adhesion to cellular linings include Neisseria, which is pictured here on the bottom right, Pseudomonas, Enterobacter, and Streptococcus. Phew, almost done. One last specialized structure, the spore, and we are done. Our last special structure is the spore. The quite hardy and sturdy spore is a dormant form of gram-positive bacteria that is triggered in times of starvation and lack of nutrients, that allows these bugs to survive for extended amounts of time with minimal needs. There have been spores aged over 10,000 years, and rumor has it that a bacillus spore has been aged even 100 million years old. Talk about a long shelf life. In spore form, bacteria can resist even the harshest conditions, including desiccation, radiation, extreme temps and highs and lows, and even chemical disinfectants. And lastly, notable bugs who use spore forms in strenuous circumstances are the Bacillus and Clostridium families, which you can see to the right here. These gram-positive organisms are distinguished from others with this feature, and it's important to take note when choosing different pathogens come test day. Great job getting through all those bacterial structures. Before we say goodbye, let's check in with a quick flash quiz. What cellular structure assists in evasion of phagocytosis and is common to H. flu, strep pneumoniae, and Neisseria meningitidis? Capsules. Remember, a high-yield association for encapsulated organisms is the need for vaccination in asplenic patients. So in those with acquired asplenia or post-splenectomy, need vaccinations for protection against these three organisms. All right, time to close the book on our bacterial structure talk. I hope you found out about our pesky little bugs and how we can apply microscopic knowledge to clinical practices and considerations. After all, these structures are the basis of virulence and common resistance to prescribed antibiotic regimens, requiring specific tailoring based on sensitivities. And an important difference between gram-positive and gram-negative organisms, which really just boils down to the amount of peptidoglycan layers that they have to help retain that hematoxylin and eosin stain. Woof, that's a lot. We covered a bunch of structure specifics in a little amount of time. So definitely take another listen if you need to solidify the spline layer or conceptualize capsules a little more. Again, my name is Lindsay, and it's been a joy joining you for the discussion today. If you thought this video was helpful, be sure to throw a thumbs up down below. See you back here for more flash facts soon. Good luck and happy studying.